So I wanted to share this case with you guys. It's an interesting case of a patient wanting to restore her teeth. She had actually lost her front and back teeth a few years back. She was wearing a denture for a long period of time that didn't seem to be working anymore. So the first thing when I have these kind of cases is to look at the situation intraorally and to decide whether or not I can actually save the remaining teeth. It's a bit tricky because you can see that the bone levels are much higher than they should be. They should have been somewhere here when there's been a lot of bone loss almost everywhere. Same thing goes on the lower teeth as well. There was a little bit of mobility on certain teeth. So the decision to extract all the remaining teeth was taken alongside with the patients. So we decided to extract everything and start from scratch, restoring her teeth with implants. Now, what I'm about to tell you is how we proceed at Dr. Michael's. Things are a little bit more predictable in terms of the first number one step we do with patients restoring or coming for full mouth rehabs is to do a CBCT or a cone beam CT scan that will allow us to design the smile and along which decide where we have to place the implants. In other words, we kind of like plan everything ahead of time before we get to the surgery time. And when the patient comes for the surgery, we have a 3D printed surgical guide that will tell the surgeon where to exactly place the implants. Things are again predictable. It's pretty much like flying a plane on autopilot mode. Once the implants are in place, things are much more simpler, much more faster. Instantly on the same day the implants are placed, we could eventually put the pillars on top of the implants, what we call the abutments that will come on top, and the prostheses will come and sit on top of these abutments that will be screwed inside. So in other words, our patients in 24 hours, they could come looking like this or like this, and they could get out of our office looking like this, or more specifically, like this.